Good morning everyone. Thank you so much for watching my last video and welcome back to my channel. Today we are going to start about the medical coding modifiers. Dear friends, when you search the word modifiers, the literal meaning of modifier is a word or phrase that makes specific the meaning of another word or phrase. Similar to that, in medical coding, modifier indicates that service or procedure that has been altered by some specific circumstance but not change in its definition or code. Basically, modifiers are two digit. Sometimes it will be the alpha, means the alphabet like A, B, C, D we can use, and sometimes it will be the numeric. Numeric means number like 1, 2, 3, 4, and the modifiers provided additional information, but it will not change the meaning or definition of any procedure or any E&M codes. In medical coding, we can find out two kind of different level in modifiers. Level 1 modifier and level 2 modifiers. Level 1 modifiers, normally known as CPT modifiers, and that consist numerical digits, and it is updated annually by AMA, American Medical Association. And the examples of modifier level 1 like 25 modifier, 24 modifier, 26 modifier. And in level 2 modifier, basically it known as a HIPX modifiers that consist of alphabets and sometimes numbers. It is also updated by annually by CMS, Center for Medicare and Medicaid Services. And examples of HIPX modifiers like T1, T2, T3. Usage of modifiers. As we know that modifiers will be only the alphabets or sometimes it will be the numbers. So one more rule here applicable: whenever we are using the modifiers, it will be always suffix of the CPT procedures or E&M codes. Means we can assign the modifier after the CPT codes. So again, the modifiers are divided into two categories: E&M modifiers like 25 modifier, 57 modifier, 24 modifier. This modifier can be used only with the E&M code. E&M code means like outpatient E&M code, inpatient E&M code, observation E&M code, critical care E&M codes. This modifier cannot be used with the procedure code CPT codes. Similar to that, procedure modifiers. So these procedure modifiers can be used only with the procedures like lab testing, any surgeries like minor surgeries or might be major surgeries, any radiological examinations. So these modifiers can be used only with the procedure CPT codes. Dear friends, as we know, in medical coding we have wide range of modifiers which is divided into different categories like E&M related modifiers, radiological related modifiers, and lab testing related modifiers. So today I am going to explain about the E&M related modifiers. In medical coding, we have the three major modifiers which can be frequently using with the E&M codes. That is 25 modifiers, 24 modifier, and 57 modifiers. So what is 25 modifier? 25 modifier, it is a significant separately identifiable evolution management service by the same physician or other qualified healthcare professional on the same day of procedure or other services. So basically, modifier 25 stop the bundling of E&M visit into the procedure code. When the physician reviewing the documentation, the career should be able to determine that both E&M code and procedure code were medically necessary. As always, the documentation must support the claim that your office sent the insurance to the identify the procedure has been performed on the same day of evolution management. Let me help you with the example. A patient visits the cardiologist for an appointment complaining of occasional chest pain, discomfort during exercise. The patient has a history of hypertension and high cholesterol. The physician completes the office visit. It is determined that the patient needs a cardiovascular stress test that is performed the same day by same physician. So here you can see that the physician completed the evolution and also the same physician performed the stress test. So the physician here we need to bill E&M visit as a like office visit as it is completed in the office outpatient office. So we need to assign the code series range from 9920 to 99215 and the physician same day performing a small test along with the E&M code. So for the stress test we need to assign the CPT code 93015 and we need to assign the modifier 25 to indicate that there was a separately identifiable E&M on the same day of procedures. A few rules to remember when to use modifier 25. So as per the NCCI General Coding Guidelines, modifier 25 may be appended to the E&M service reported with the minor surgical procedures. Minor surgical procedures means the procedures which having 0 to 10 days of global period. Since minor surgical procedures include pre-procedure, intra-procedure and post-procedure work, so the provider should not report additional E&M service for this work. Furthermore, medical global surgery rules prevent the reporting of separate E&M service for the work associated with the decision to perform a minor surgery procedure, whether the patient is new or established patient with the decision to perform surgery the same day or next day. So to avoid this confusion, we have some certain rules that need to be followed while assigning the modifier 25. So rule number 1, modifiers are needed to inform third party payers of circumstances that may affect the way payment is made. The modifiers tell a story of what being is done. So the first rule is applicable for all modifier, whether it is a E&M modifier or whether it is a procedure modifiers. So this rule is applicable for each and every modifier. The next rule for the E&M modifier is always link the modifier to the E&M CPT codes. So dear friends, as we know, modifier 25 is designed only for the E&M CPT codes. So whenever we are assigning modifier 25, so always we need to make sure that we are assigning with the E&M CPT codes. We should not assigning with the procedure code. Okay, so moving to the next rule, it is not necessary to have two different diagnosis code. The last rule is need to document both ENM and the procedure code. So whenever we are assigning modifier 25, we need to make sure that in addition to ENM CPT, we have some other procedure CPTs, then only we can assign modifier 25 with the ENM CPT. Dear friends, these are the rules when to use modifier 25. Also, we have some rules when we should not use modifier 25. So, rule number 1, do not use modifier 25 when billing for service performed during a post-operative period if related to previous surgery. It means that if the patient has completed a surgery and during the global period he visited for the same condition, so we should not assign modifier 25 with the ENM service. The next rule is do not append modifier 25 if there is only an ENM service performed during the office visit. So suppose if any other procedure is not performed during the office visit, we should not assign ENM modifier with the ENM CPT code. Do not use modifier 25 on any ENM on the day of major 90 days global procedure is being performed. So as earlier discussed, modifier 25 can be used only for the minor surgeries that belongs to 0 to 10 days of global period. 90 days of global period, it is considered as a major surgeries. So that time we need to assign modifier 57 that we will discuss in our next video. And for the major surgeries, we should not use modifier 25. The next rule is do not append modifier 25 to ENM service when a minimal procedure is performed on the same day unless the level of service can be supported as a significant separately identifiable. All the procedure have a ENM service included. For example, when a patient is scheduled to come to office for cardiovascular stress test and the physician also complete a history and perform a limited examination related to stress test, your office should only code for the stress test. The office should not assign the ENM code here. Moving to the next rule, patient came in for scheduled procedure only. So whenever the patient came only for the any surgery or the procedures, then we should not assign the modifier 25 along with the ENM code. This is all about modifier 25. In my next video, I will discuss about the remaining modifier for the ENM. Thank you so much for watching this video. See you soon.